Hello, and thank you for joining us for episode 2 of Jingle Jangle. We're a little more haphazard this round. I mentioned that in the beginning. And upon listening back, now editing, my mic is not where it should be, so apologies for the quietness. Perhaps we should start calling it Jingle Jankety. Either way, thank you for listening, and I hope this provides some easy background listening while you get some homework done. Hello, Dr. Sai.
Hi, Ben. Here we are again.
That feels weird. This is what, episode 2?
2.5?
You want to call
maybe?
it 2.5?
I mean,
are we alluding to the non-existent episode?
It depends on whether or not you want to admit your technical error.
No, we'll admit it. I spent the entire last time we recorded with a muted microphone, so we heard Dr. Sai in full 4K, and then me and down the hall and around the corner. So
you'd think that 5 years past the height of COVID and everyone saying you're on mute, you'd think that would have sunk in by now.
I didn't do school during COVID.
That's right, because you're an oldie.
Yeah. I'm ancient. Apparently, I guess late 20s is ancient now.
Some of us were born ancient.
Really?
Yeah.
Oh. Okay.
I mean, I think like Athena, I sprung fully formed.
The student?
No. The Greek goddess. Yeah. Parthenogenesis, right?
Yeah.
I've been a grumpy old man since I was an infant, I think.
Crotchety or grumpy?
A little of both. Some
Right.
from column A, some from column B.
Just like that Robin Light. All right, never mind.
Yeah.
There was some things we wanted to actually talk about today.
There were, and before I forget, I had some corrections to make from the first podcast.
Yes.
Yeah. So one was we were talking about names of drugs and how to remember them, and for the most part, it's not like A and P where the names have these neat etymologies. Drug names are not quite that interesting, and so some of them can be hard to tell what they are just by their name, but not all. There are certain drugs that have something in common, and the example I used was the beta blockers, which all end in LOL, lol, except for one, and that's sotalol, which is actually a potassium channel blocker. I said it was a calcium channel blocker. So we're now past, well, I guess there's one group left to take their exam this afternoon. But
this will come out a week from now.
Yeah, so most of the second years have already taken that exam that covers the beta blockers. So I don't know that the correction now will help. If second years are even listening to this, I don't know.
Well, for posterity.
For posterity. Let's see, what else I had on my list? Oh, Alex was the name of that that African gray I was trying to remember.
Okay, where did you find that information?
I Googled it.
Okay, because Lisa Bach, one of the instructors, listened to our podcast and put in all caps with 3 exclamation points, I believe, on the comments of our podcast, Alex.
Yes.
Because it was Alex.
I'm so ashamed I didn't remember. And interestingly, that stands for Avian Language Experiment.
Interesting.
So, yes.
That feels somehow... I feel like the wrong term is dehumanizing, but it feels dehumanizing.
I guess that goes back to, I think last time...
Anthropomorphism?
Yeah, and the podcast that we didn't get to hear your part of last week, you were talking about using... different term, creature versus being versus
animal.
Yeah. So I think it ties into that.
Well, if we want to go into that.
Well, there was one other. Well, there was one other thing I wanted to say from the first time was you had asked me about strategies for dealing with pharmacology, and I said I'd think about it. And one thing that came to mind to me after the fact was. And I know not everybody works in a practice.
Oh, this is good.
Yes. So we were told as fourth year students when we went down to clinics. Now, in fact, in veterinary school, they start getting you into clinics much sooner than your fourth year, which I think is great. But we were mostly in the classroom the first 3 years, and then on the teaching hospital floor the fourth year. But we were told that fourth year to carry a little notebook around with us or a set of note cards on a ring or something so that we could take notes about cases. And
before the age of phones.
Yes. Well, we had soup cans and a piece of string. Yeah. So we would jot notes down as we were seeing cases, and it would help solidify things in our minds. So for those who do work in a practice and you see drugs that are being prescribed or used, or maybe you're filling those drugs, if you have those responsibilities to fill those prescriptions, make notes about the case. Why, what type of animal is getting this drug? Why is it being used? Use the plum that's at the clinic or that you might have to look up and find out, what its effects are and its adverse effects and things. And the more you can relate these drug names to what you're actually doing, the more it's going to cement in your mind.
The more you can make practical connections to theory about words that are far too long for most people to pronounce.
Otherwise, it's just a bunch of names.
Yeah, otherwise you just end up looking at words all day.
And I mean, some of us like to look at words all day. I think you and I both agree.
You don't need to call us out.
We're
being pretentious enough. We have a podcast.
That is true. All podcasters are pretentious.
I'm for fear of outing myself, I will say no comment.
Oh, okay.
But yes, being able to relate practical experience to the theory you're learning in class is incredibly helpful.
Absolutely. It goes back to like what I said all through A&P is lay hands on animals. Making sense of where these.
Go home and feel up your pets.
And your friends' pets and your family's pets.
But it's true.
Yeah. I mean, the more you relate what you can find on an animal at home that's fully fleshed out to what you're seeing on a bare bones skeleton in a lab or a hacked up cadaver, the more it solidifies.
Yeah. I actually had a similar experience like that at Jane's Journey Home.
Oh, okay. Yeah, you guys went...
we took a field trip.
At least your section did. I know that different sections have gone at different weeks, but yours went yesterday.
Yeah. We ended up looking at a lot of senior animals that live there. For those who don't know, Jane's Journey Home is effectively a end-of-life care for dogs. They take as many as they can reasonably handle of very geriatric patients, so they're far beyond what their expected lifespan would be.
Yeah.
I believe there's a 17-year-old dachshund.
Wow. Okay.
We are a gray muzzle, but seeing all of those, seeing a patient with dementia, you could tell that something was a little off because they just kind of kept wandering. It took me a couple minutes to realize that no, they don't stop moving. They don't know where they are. And it was interesting to see. There was a pit bull miniature pinscher mix that had lymphoma.
Okay.
And you could see the lymphoma, but you could also feel the difference in lymph nodes each side.
Okay. Yeah.
And so having that previous knowledge of like where they are gave me some insight into no, this is strange for this dog. Obviously it is strange because you can see some of the masses. Because it had metastasized, but it's also just sort of, I understand what normal looks like now.
Yeah.
And so you can relate normal to practical experience.
Yeah, and not just what looks like, but sounds like. So, assault as many animals as you can, feels like, all of those things. Yeah, all of our senses, except for probably taste. We're not going to be tasting specimens
I wouldn't recommend
anymore.
it.
No.
Anymore?
Well, I mean, once upon a time, that's how diabetes mellitus was diagnosed, right?
Right, yes.
Yeah, sugar in the urine. If the urine was sweet, person was diabetic.
I feel like there were, even back then, there were better ways to test for this.
Probably, but maybe some people, isn't there a TV show, My Strange Obsession or something like that? And one of those was somebody who liked to drink their own urine?
Isn't that just Bear Grylls, though? I also, last week in the Forgotten episode...
the Lost episode.
Yeah. There we go. There was a whale paper I discovered. We've been doing a lot of sedation in animal care and management, too.
That's right, and I made an awful pun about sedations.
Yeah.
Yes, because whales are...
Cetacans.
Yes.
Which is a fun word to say.
Yes.
It feels too close to crustacean, almost.
It does. I'm sure the ending is...
Related,
yeah.
But to sedate whales, they use some of the same drugs. They use midazolam, dexmedetomidine, and at far, far greater concentrations to give a relatively small amount of liquid. I have the paper up in a moment because I pulled it up remembering that I wanted to talk about it. Yeah, for the assumed weight of the whale, because you can't weigh a whale in water.
I wouldn't think it would be very easy, no?
I mean, you could put them in a net in a helicopter, I guess.
So how did they weigh the whale?
They didn't.
Oh, they didn't. They estimated.
It's a complete estimate.
Estimate.
45,000 kilograms.
That's a lot of kilograms.
And that's roughly 2.2 pounds to the kilogram, so almost 100,000 pounds.
That's a big animal.
And the dosage was still 0.01 per kilogram, 0.01 milligrams per kilogram.
Of the midazolam.
And they ended up with a concentration of 90 milligrams per mil. So, quick math, that's not a lot of drugs for a 100,000 pound animal.
No.
But
I mean, it depends on that particular animal's metabolism.
physiology.
Yeah, I mean, right. Yeah, the whole
Is that pharmacokinetics?
Pharmacokinetics. Yep. Absorption, distribution, metabolism, and elimination.
Drugs to animals is kinetics, and animals to drugs is dynamics.
Yeah.
So
I'm not quite, the way you phrased that confused me.
Pharmacokinetics.
Now I know how the students feel.
Pharmacokinetics is what drugs do to animals.
No, other way around.
That's what we just went over.
I know it's just what we went over.
No, not...
Kinetics is movement of the drug through the animal.
Okay.
So it's what the body does to the drug.
Got it.
And dynamics is what the drug does to the body.
Well, see, this is helping me already.
Yeah. But I think you just took the exam. I think you got those questions correct.
I have no idea.
I don't know. I graded so many exams in the last couple days, I don't remember.
Perhaps
I just
know can bother Dr. Sy to check my mail.
Perhaps you could. In general, though, actually, I just graded the last, other than the satellites, I just graded the last Farm 1 exam this morning, and everyone did really well, actually. I think the lowest score was an 80.
That's really good.
Everyone passed. So
congrats on being a good teacher, I guess.
Well, I mean, I always say I give you the tools. What you do with that,
it's in the students' hands.
Yes, yeah. All the hard work is on your end.
A couple of the notes I have from the Lost episode is talking about how the VTNE is a national exam.
It is,
but there are state exams too.
There are.
And does Wisconsin have a state exam?
It does.
Is it as extensive as the VTNE?
No, and it's quote unquote open book.
Oh, okay.
Back in the day, it was literally a book. You got mailed a book and a Scantron sheet. Now it's online.
Okay.
But you are still allowed to look at it. Basically, what it is, it's a copy of the statutes that govern veterinary technology.
Making sure that you know.
Make sure you know. Yeah, and because it is open, quote unquote, book. More than knowing them, because who's memorizing these things? It's so that you know how to find the information you need, where to go in the statutes to find the information you need.
In case you get to the point where you need that information, they want you to be able to find it.
Yeah. So don't do what some classmates of mine did, because the veterinary state exam for Wisconsin, we had national exams. We had 2 national exams back in my day. We had to chisel them with a hammer and chisel on a stone tablet. Cuneiform, Babylonian cuneiform.
Oh, you speak it?
It's been a while, so I'm a little rusty on my Babylonian. Rusty. Yeah. Anyway, so we had the 2 national exams. Now there's just 1 national exam for vets, the NBE. And then we had the written test, which was, again, open book back in the late 90s. And some of my classmates decided, okay, you do questions 1 through 25. I'll do questions 26 through 50.
That sounds like it'll go
and then we'll switch. We'll switch and copy so that none of us has to do the entire test. Well, they didn't pay attention that the questions were not all in the same order.
That sounds like it'll go well.
Yeah, so a lot of them didn't pass the state exam out of sheer laziness, stupidity, stubbornness. I don't know. I'm sure they were just able to retake it. It's not a big deal. Although I think it costs money. I don't know what it is nowadays to take the test. But there is for the vet techs, there is a written test for Wisconsin. Not all states have a test.
Interesting.
Not all states actually require some sort of certification. Really, yeah. There are a few states, I don't know off the top of my head, but there are a few states that don't require veterinary technicians to have any sort of licensing at all. And then I think the majority of them do, and the majority of those have a test. There are a few that I think just accept the national test and don't have their own state test.
There was an interesting thing that came up in laboratory animal science
Okay.
this week.
Yeah. Lots of shouts out for Lisa this week.
Well, she's a wealth of information.
Yes, she is.
She was talking about how to be certified as a laboratory animal tech. That's an international certification, unlike the VTE.
Oh, I guess I didn't realize it was international.
So if you are certified as a lab animal tech, you can go to Germany and go be a lab animal tech, which is not the case for most veterinary professions.
Right.
If you come from Indian veterinary school, if you come from Chinese veterinary school, you have to come here and spend some kind of amount of time retaking classes. And
yeah, I think it varies by the country.
It varies by country.
But yeah, sometimes you have to have a sponsor. Basically, you work under the supervision of a U.S. licensed veterinarian, and they sort of sponsor you. And yeah, there's different rules and regulations. I don't know. I'm a UW. Oh, my voice cracked. Must be from the emotion.
Yeah, clearly.
U-rah-rah on
Lord.
Wisconsin. I'm a UW grad, so I don't know much about foreign vet schools and getting licensed after that. But
it was interesting because vet techs aren't even the same in the country. You have to go to different states to get licensed by different states. Well, nationally you can be a veterinarian, while internationally you can only be laboratory animal science. It was just interesting where we make the distinction.
That's, who decides things like that? It's the politicians. So
True.
What do they know?
The last note I have here, and then we can figure out what else to talk about.
Yeah.
Is antibiotics for salmonella and antibiotic-resistant salmonella. That's what came up last week, and talking about how antibiotics stewardship is becoming wildly important because we are in an arms race with tiny things we can't see.
We are.
And that's horrifying.
Yes. I have often said that I don't think it's going to be nuclear war or something like that.
Aliens.
It's going to take us, aliens. It's going to be some virus, some bacterium.
See, I think what terrifies me the most about that is when in the discovery of the New World, in this history with Ben, in the exploration of the New World, as it is called, the Americas in the 1700s, we brought smallpox, and that was a 90% mortality rate on native people, which is truly mind-boggling. But please.
No, I mean, some of it was unintentional.
Most of it was unintentional.
Well,
and then there was the times we used biological warfare.
Yes, where we intentionally gave native populations blankets that were
laced with smallpox.
Yes, so yeah.
There's a lot to unpack there.
Yeah.
My point was more that it was a pathogen that the New World had never seen.
Mm-hmm.
They were separated by an ice bridge for Czechs
a long
watched
time.
sarcastically 20,000 years or so.
Something like that.
We keep looking for life on other planets, and we don't expect to find multicellular life. We don't expect to find plants. We don't expect to find animals. We don't expect to find insects. We expect to find microbes. I don't want to catch flu from Mars.
The literal Martian death flu, yeah.
That sounds horrifying.
It does sound horrifying.
But also, how do you control for that? Because somewhere, because a lot of, what am I thinking? Allergies. How we identify pathogens in the immune system is effectively random chance. We build things on the molecular level that attach to other things, and that's how we go, oh, that's avian flu.
Yeah.
Oh, that's tuberculosis.
Yeah, and it's random.
It's completely random.
Yeah.
What are the odds that we have the immunological print of Martian death food randomly.
My guess is not very good because
We've never seen
presumably that life is going to be of a completely different. It may not be carbon based, right? It could be silicon based or something.
Do we have anything that's horrifying? Do we have immunological resistance to anything that's not carbon based life?
I don't. I guess I don't know, but I don't think so.
The questions for next time.
Yeah.
I'll add that to the list. Is
right.
Immune system response carbon based?
My guess is probably. I mean, if antibodies are proteins, and what are proteins but chains of amino acids,
and those are
it's all going to right. Yeah, carbon backbones. Yeah. So, for any of you who are excited someday about perhaps being visited by aliens,
yeah, sure.
I wouldn't be
clinical pathology.
I wouldn't be, because chances are it's not. I mean, again, going back historically,
it won't go well.
It will not go well for the for the native inhabitants of this planet. It will not go well.
Either they will have the sci-fi equivalent of muskets.
Yes.
Or they will have the sci-fi equivalent of smallpox.
Yes.
Or they'll want to build a hyperspace bypass. And then back to
and recite very, very bad poetry.
Oh, death poetry.
Vogon poetry, yes.
Which is horrible.
That for those of you who don't know, we're referring to Douglas Adams'
The Hitchhiker's
Yeah. That book, the first one, has a metaphor in it that it's my favorite metaphor ever.
Is it really true?
Well, it describes the alien ships, the Vogon ships. It describes them as hanging in the air the way that bricks don't.
That is incredibly illustrative. I have never thought about it that
And
way.
I aspire to write like that. Douglas Adams, I wish I could write like him.
He writes very well.
Wrote. He's passed on now.
What was that book that he wrote about the environment?
Last Chance to See.
I really want to look into that book because I've a couple of my classmates have been looking into it, and it's a book about environmental protection.
Yeah, he goes. I can't think of the name of the co-author off the top of my head, but he goes around the world with I think a naturalist or an environmentalist, and yeah, they're looking at species that are in danger, of disappearing. So yeah, it's about extinction events and conservation and
interesting.
Yeah, I mean it's an older book now, probably what 80s, 1980s, 90s.
I'm sure we can.
So I'm sure things have gotten. I'm such an optimist.
I'm sure they've gotten.
I'm sure
worse.
they've gotten worse. I mean, we've had some success stories, right? There have been some animals that have been brought back from the brink.
Speaking of, it was 1989.
Okay, so yeah.
Whoa, hold on. The book was not 1989. The book was 1990. Apparently, there was a radio documentary series on the BBC.
Really?
Yeah.
I'm gonna have to check the Internet Archive or something.
I'm
see
very
if I
interested
can.
in that.
Yeah, I would love, especially if he narrates it.
It is presented by Douglas Adams and Mark Cardwine.
Okay. Yeah, because I have I think I have all of the Hitchhiker's books narrated by Adams himself. So.
I liked the radio play. The radio play was very good.
I think I might have picked that up from the library and put it onto my iTunes. I might actually have a copy of that. I also have the copy of at Half Price Books. I found the original TV, the BBC,
the BBC
TV.
radio
Yeah,
show?
yeah.
Or
Well,
the TV show?
the TV show. Yeah, because the movie, as much as I love Martin
okay.
Freeman and Alan Rickman, I mean,
It could be better.
yeah.
They did a good job on the robot.
You talking about Marvin?
Yes,
yeah,
Marvin.
and with Alan Rickman voicing him, how could it be
How could it
anything
not?
but? Yeah.
Another
Another soul who left us much too early, Alan Rickman.
Agreed.
Yes.
There was an interesting thing that just came to my brain talking about Last Chance to See. What the heck was it? If you have anything, I'm going to see if I can search the internet.
Let's see. I could sing to.
No.
No.
This is a podcast, not a Spotify channel. Even though we do have one, Jingle Jangle. Please listen. I don't know.
Oh, the channel. Okay. Yeah. Oh, speaking of the podcast and the channel, did we have any other comments besides Lisa's?
I didn't look deeply.
Okay.
Because I was surprisingly, for no one, preparing for school.
What?
While the student is in school and needs to go to school.
Not the day before an exam, right? Because what you're supposed to do.
No.
No one listens to me.
Nobody listens to you.
Nobody listens to me. At noon, at least, the day before the exam, you stop
thinking about school.
Stop thinking about school. Do something enjoyable. Get a good night's sleep that night.
So you don't end up wildly stressed sitting in class.
Right.
It's not coming. It's not going to come to.
All right. Well, jot it down. This is something
later.
else about last chance to see. I'll
Yeah.
jot down last chance to see something, question mark.
Yeah, there we go.
All right.
I've been fascinated with ethology, right? That's the
Animal behavior?
Yeah, the study of animal behavior.
At least as another fountain of information about that.
But even in like fictional settings, where
Fictional settings.
where animals are generated from our mind based on what we think creatures like this would be.
Okay.
My best example is dinosaurs,
Mhm.
paleontology. We can't go out and observe a velociraptor for 6 days on end.
Not yet. Not until someone finds that dinosaur
We're
DNA
not
preserved in a mosquito in
Oh,
amber
We have that already.
and mix it with frog DNA.
We're making woolly mice. Do you know about this?
Feel like I've heard something about it.
We are attempting to return woolly mammoths to the planet
Using mice?
using mice.
There's a little bit of a size differential there.
Yes, we are. What we're trying to do is we're trying to isolate what makes woolly mammoths different than elephants.
Will the mice have the big tusks?
No, but they do get fluffy and brown.
Okay.
Which is it's been successful. We've been finding what makes woolly mammoths different than elephants, so we can use elephants as a surrogate mother
Uh-huh. And why are we doing this?
to bring mammoths back.
But why?
We have a almost perfectly preserved frozen mammoth from an iceberg that is a child, and so all of its cells are not degenerated or old or might have a defect.
Again, but why?
For science and posterity, I suppose.
I mean, I can see, so the passenger pigeon,
Yep,
that was wiped out by
by humans.
humans. I could see maybe trying to bring back some of those species,
Well,
but
we have pictorial evidence that we did hunt mammoths. Is that enough for you?
I suppose. But I feel like their extinction was probably, that was an Earth event, right? It was
Yeah.
not human.
Act of God or whatever.
Yeah.
Um,
So, okay, so we're bringing back the mammoths.
Yeah.
But you were saying about dinosaurs, and we
just
can't.
that if we can't study the ethology of creatures that aren't here anymore.
Right.
And we can't study the ethology of creatures we invent in our own mind.
Well, is that true? The
Of
ones that
creatures
aren't
we
here
don't have
anymore? I mean,
well-
don't we know some things about, at least
We have
think we
video
know
of
some
the
things about
thylacine.
behavior? Of the what?
Thylacine.
We have video?
Yeah. There's video of thylacines.
Explain.
You not aware of video of thylacine? There's exactly like a minute and a half of video of a thylacine.
No.
Yeah. For those who don't know, thylacines are Tasmanian tigers.
Oh, yeah. Okay. You're right. Yeah, I
Yeah.
have seen that. I did not know. I'm going to confess my ignorance. I did not know what a thylacine was. But when you said Tasmanian tiger,
Thylacine does sound fairly paleontological.
yeah, and also pedantical.
Yeah, all right.
Yeah.
Thylacines are Tasmanian tigers. They were wiped out, became extinct in the early 1900s.
Something like that.
But they were, the last couple were housed in a zoo in Australia, I believe.
Australia.
Yeah,
Australia.
Australia might.
Yeah.
And they are fascinating creatures because they had a very dog-like form,
Mm-hmm.
but were not dogs in any meaningful sense. They had more cat ethology,
Mm.
and so
Well, it's like the fox. They say
Yeah.
a fox is
cat software on dog hardware.
boy. You took the words right out of my mouth.
It's fascinating
Yeah.
because they don't act like caniforms, for lack of better terms.
Yeah. Okay.
That's just where my mind has been the last week, is the ethology of creatures.
But scientists do think we know something about dinosaur behavior, right? We know
Sure.
and based on their teeth, right? We know that we know a little bit about like their hunting patterns and
relative like stature and
yeah,
what they
yeah.
eat.
And so some degree of behavior I think we know about. We don't know what they really. I mean, who knows what they really sounded like, right? I mean, birds are the modern equivalent of dinosaurs, right? What if
Chickens.
Tyrannosaurus Rex
Sounded like a chicken.
crowed like a rooster
That'd be
in the
weird.
morning? Wouldn't that be weird?
What my brain came to bring it back to more veterinary technology.
Yes.
Do you think large reptiles have some of the same problems with the drugs that we use in vet tech? Because I learned it during doing neurology for 82 that turtles have an incredible problem dealing with chlorhexidine to the
Really?
point that you can't even use like a 2% solution of chlorhexidine anywhere near them.
Did not know that.
Yeah, chlorhexidine is really bad for
Even
turtles.
topically on the skin?
Yeah.
I feel like they have such
Nope.
thick skin that it wouldn't even absorb.
Chlorhexidine.
Huh. So what does it do? So it,
I'm not sure because it wasn't super important to 82 because we were focused on companion creatures.
and you can't get Lisa as distracted and off on a tangent like you can with me.
Neither can you get Melissa, who teaches 82.
Oh, I'm sorry. Melissa 82, yes.
But I also learned that ivermectin, a lot of our antiparasitic drugs for large animals use ivermectin.
Yep.
Horrible for turtles. It will cause respiratory seizures, and to the point where they will not breathe.
This has just been exposed as Dr. Cybela's Ignorance Day. As I did not know that. I am not, as many of you know, I am not an expert on species.
Other than cats and dogs.
I'm primarily a cat and dog guy, yeah.
Well, I don't think you were supposed to know chelonians for shelter.
Oh, I got to trot out the scientific names.
Yeah, because it's fun to say. Chelonian is the scientific name for the species that is turtles.
Yes.
Should
we pull out the squamata again and talk about squamous cells?
Well, no, I was just going to go to the snakes and Ophidian. But,
snakes are squamata.
Really?
Yeah. That's the order they belong to.
Interesting.
They have scales, just like squamous cells are flat, scale-like cells.
Okay.
Yeah.
But I was curious about, so chlorhexidine is recommended for us to use as a scrubbing agent. It's really good at getting rid of bacteria, and it's a phenomenal cleaner.
Antiseptic, yeah.
Antiseptic. Yeah. Apparently, it is horrible for turtles, and I want to know how and why. Because that seems like trouble, just to be able to bring your turtle into a vet somewhere and make sure that there's... Obviously, the vet's going to take precautions because they will know this if they're an exotic vet.
I mean, if they're seeing turtles, they hopefully would know that.
Yeah, but it just seems like it makes it even more of a hassle, I suppose, to begin treating exotics in the same way. Petco, I don't know if we trust Petco, but I'll do some research because it was an interesting tidbit of information that's relevant to people going into exotic animal med or someplace that would see turtles.
Yeah.
Because, go ahead.
Oh, I was just say I was going to get in my plug there. I know I put this in my bright space in other resources for vet tech students. I don't know how if everyone reads that, but if you are interested in any exotic species, and by exotic I include the word exotic kind of seems silly because a hamster, is that an exotic? A rabbit, is that an exotic? But anything other than your typical dog or cat, so if you're small mammals, reptiles, birds, amphibians, that sort of thing, there is an excellent website. It's Lafeber Vet, LAFEBERVET. And there is just a ton of information about all of those species on there, everything from basic care guides like husbandry. And again, with those species, 80% of problems that we see with those species are husbandry, improper diet, improper...
hypervitaminosis.
Yeah. Everything from that to like how to do certain procedures. A lot of it, like some of the videos, procedure, and there's CE for those, once you graduate and you're certified, you need to maintain CE. A A lot of it is available just to anybody going on the site, but some of the stuff, especially the more detailed stuff or the CE, you have to register for the site, but it is free to register.
Sounds really good.
And it's not one of those where you register and then you get spammed. I don't think I ever get, or very rarely get, emails from Lefebvre. But it's always my go-to place. Again, I'm a dog and cat guy, but here at the college, depending on the semester and the time of semester, we might have guinea pigs, rabbits, mice, hamsters, and if there's something I need to look up,
Brush up on your...
I go straight to Lefebvre.
Interesting.
Yeah. So my students, which I think, again, I think everybody.
Mm-hmm.
I have first, seconds, and tweenies in farm, most of them anyway. I think there are a few tweenies that aren't taking farm, so there might be a few that I don't have. But on my Brightspace site, under other resources for vet techs, under the Start Here section, I have the link to Lefebvre, along with several other recommended links. I recommend everyone join VSPN, the Veterinary Support Professionals Network.
That very cool.
Yeah.
Very cool place. I didn't find enough, but I do have some drug-related questions.
Okay. Can expose my ignorance some more?
No, in my search for understanding why chlorhexidine is toxic to turtles,
Yes.
I found a paper that is, quote, a case study on the wound management of a Florida box turtle.
Okay.
But I came across some drugs that have similar sounding names, and I understand what they're for. But I've never heard of them, like
Ceftazidime?
Yeah, ceftazidime.
Yeah, that's a cephalosporin, antimicrobial.
Okay.
Yeah, maybe I'm contradicting myself here. I said that, you can't follow, like, drug names aren't, but
You can for the most part. There's just
there's
always exceptions.
There's always
to rules.
exceptions. But yeah, most of the drugs that begin with Ceph, either CEF or CEPH, are cephalosporins of some type. They are related to the beta-lactams, which are your things like penicillin and amoxicillin.
Mm-hmm.
They have a similar chemical structure. Yeah. And there's in Farm, it used to be Farm 1. I think it's been moved to Farm 2 now. For those who will be taking Farm 2 next year. There's different generations. So the first generation cephalosporins, like cephalexin, have a certain spectrum of activity, and it tended to be mostly gram-positive organisms.
Okay.
Not so good at, like, gram-negatives. But as they've developed newer ones, the spectrum has gotten broader, and in some cases, some of them they've gotten much better at gram-negative organisms, but they lost some of their efficacy against gram-positive. It's something you'll learn about in Farm 2.
I've come across more things that make sense to me, but more things to think about. They had to give lidocaine,
Okay.
which is, I believe, how you pronounce that.
Yeah, I would assume.
They gave lidocaine to the turtle in the semitendinosus, so they gave a caudal thigh IM injection to a turtle. That sounds incredibly difficult to make sure you hit where you're trying to look for without hitting the nerve, just based on how big the turtle is.
Yeah, I'm also a little surprised because...
Well, you can't give it epaxially. There's a shell in there.
True, but reptiles have what's called a renal portal system. So in mammals have a hepatic portal system. So especially drugs that are given orally, they end up in the GI tract, they get absorbed, and then blood from the GI tract ends up passing through the liver first, right?
Because the first pass defect.
Yeah, and some of that drug can be removed before it reaches the general circulation. Reptiles have a renal portal system.
Okay.
So anything that's given in the, like, intramuscularly in the rear, the caudal end of the animal, will pass through the kidneys first, and there can be a first pass effect through the kidneys in reptiles. I'll have to look that drug up. It is clearly related to, it's a sodium channel blocker, I assume, like lidocaine and bupivacaine and those. So those drugs close off the sodium channels on neurons, and if those can't open, ions can't move, and you don't get a nervous impulse. That's how those drugs work to block pain. So I'm assuming that's similar. So I'm going to have to see, maybe that's a drug that's not highly metabolized by the kidneys, and so it would, because otherwise it seems like that would be defeating to give that and then have a lot of it removed by the kidneys before it gets to where, Are they using it? So what are they using it for? Is it for anesthesia or is
The
it?
turtle remained in one of the hospital holding cages for treatment, and the observation was approximately a month. Lidocaine at 5 milligrams per kilogram, diluted 1-to-1 with water, for injection was injected ventrally into the semitendinosus muscle perilegionally.
So this. Oh, did you say this was about a wound?
Yes.
Yeah. So I wonder if it had a wound. It must have had a wound in the limb.
Yeah.
And so it was being infused locally
That makes more
around
sense.
the wound. That makes more sense. Yeah.
Almost all sensitivity around the wound was lost within 10 minutes.
Okay.
And the veterinarian debribed the wound without the limb retracting. Debribed?
Is that IBE or IDE?
Debrided.
Debrided. Yeah, that's actually a back formation. I don't know how your French pronunciation is, but there's a word débraiement.
Oh dear.
And sorry if you speak French, I do not, so that might have been terrible. But the word debride has sort of been back formed from that. It means to clear away dead necrotic tissue, usually in a wound. So if you're going to close a wound, you want to get all that yuck out of the way, all that gunk. That's a scientific term for it. Out of the way. Yeah.
Then for pain relief, tramadol at 10 milligrams per kilogram.
Okay, interesting. So that's another one I should look up because tramadol, that's an atypical opioid, so related to drugs like morphine and so forth. But we started using it in dogs, I don't know, 15 years ago, 20 years ago maybe, and we've realized that it probably is not a very good analgesic in dogs because it requires, so tramadol itself doesn't produce analgesia, a metabolite of it does. So it has to be metabolized to something else, and
that's the pain relief.
That's what causes the pain relief. And humans, our bodies do that metabolism, but dogs do not.
Interesting.
And so we don't think it's a very effective analgesic in dogs. It might be in cats, but it's hard to dose in cats because of the size of the tablets and things. So it's kind of, we've gotten away from using tramadol as an analgesic. But this is a turtle, and a turtle's not a dog.
And cats aren't dogs
and
either.
Cats aren't dogs either, despite what we heard it frequently as a vet student that cats are not just small dogs.
No, they are not.
They are quite different in many ways, behaviorally, physiologically.
My favorite behavior that you can't do with dogs that you can do with cats is you can pour cats.
Cats are liquids.
I don't know if you've ever tried to put down a cat versus putting down a dog.
Putting down in the sense of like
placing them on the ground.
Not actually euthanizing.
No, not
the euphemism for euthanizing, putting down. So
when you place a cat on the ground,
they don't
kind of they put themselves on the ground. You can just kind of pour them out of your arms.
Yes.
I tried pouring a dog when I was very small. The dog just kind of fell on
face
his face.
planted. Yeah. Poor dog. Was he okay?
Yeah, he was okay.
Okay.
He was a relatively big dog, so
yeah.
he was fairly okay.
I have an aunt who, she's not really an animal. She likes animals, but she's one of those that keeps an immaculate house and never wanted pets in her house. But she was never. My uncle always wanted a dog, and I don't think he ever won that battle. But my aunt especially, she was also just not a cat person, and she said the main reason was she didn't like it because cats ooze when you pick them up.
They do sort of.
I mean, they're much more. They have a lot more elastic connective tissue in their spines, so they're very flexible. And they are. That's why sorry to all you dog people out there, but I think if you're going to cuddle on the couch with a pet, it's got to be a cat because they can mold themselves to your body, and to me, it's a superior cuddling experience.
It's more like having a blanket that's friendly as opposed to a stuffed animal that's also friendly.
Yes. So no offense to dog people out there. I like dogs too, but.
So apparently they used a chlorhexidine scrub of 0.05%.
But I thought we couldn't use that in chelonians.
At 1 to 2%.
But I thought they were super sensitive, like you couldn't use it at any.
Like I said, I'm uneducated.
Okay, all right.
They used a sterile 0.9% NaCl rinse, like we have here.
That would be isotonic sodium or normal saline.
Yeah, normal saline.
Yep. So it has the same tonicity, basically the same amount of dissolved substances in it that plasma has. So it neither takes water away nor.
I remember you talking about this one, but I don't remember how to pronounce it. Silver
sulfadiazine.
Sulfadiazine.
I talked about that.
You talked about sulfadiazine in one of your lectures.
Did I?
Yeah.
Yeah. Antimicrobial, usually in the form of a cream.
Yeah, that is what they use it for. And then they measured it every 3 to 5, the wound size by caliper in millimeters because it's a turtle. And so it's going to be small. Apparently, a week after it was returned to the veterinary hospital, as the wound had reopened, it was suspected to have been bitten by a cage mate. I didn't know turtles fought. Would that happen very slowly?
Turtle Wars. I mean, there was the Teenage Mutant Ninja Turtles.
Oh, we're back.
They fought.
They did.
Yeah.
I don't know that we could teach turtles ninjutsu, though.
Yeah. Well. Turtles probably, speaking of husbandry, you probably shouldn't feed your turtles pizza either.
No, you should not.
No.
You should feed them greens, specifically actually greens, and then hopefully occasionally some kind of root vegetable.
You know where you can find the best diet for a turtle?
Is this on the...
On Lefebvre Vet,
Lefebvre?
yes.
Why Lefebvre?
That's what they do. They're dedicated to those species.
Interesting.
So yeah, they're
if you forget something for more common species, cats, dogs.
Yeah.
Where do you look?
One of my favorites, and I will direct, like when I was in practice, I will direct owners to this, but I also have directed vet tech students to this because it's a legitimate site. It's related to, I don't know if you're familiar with VIN, the Veterinary Information Network. So that one's intended for veterinarians.
Mm-hmm.
And then VSPN is kind of like for everybody else.
Mm-hmm.
And then there's veterinarypartner.com, which is intended for owners.
Interesting.
And you can look up almost any topic you want on, I think, almost any species, and it will give you very detailed information about whatever that is. So if I diagnosed an animal with diabetes mellitus or hyperadrenocorticism or something, I would obviously talk about the disease and the treatment and the risks and the benefits and so forth. But, owners, that's a lot to throw at them. So I would often, I'd print out the sheet from Veterinary Partner, or I'd direct them to that website that they can go and read about it. It's very detailed, but it's written for owners, so it's not over their heads. Owners can understand it. It's at that kind of level, but it still provides a lot of good detailed information, and it's reliable because it is associated with VIN and with VSPN. So it's an excellent site. So I always, if students are writing a paper for like animal disease or something like that, I say Veterinary Partner is a good place to start because it gives you a lot of information. It's not too technical, so a first-year vet tech student should certainly be able to understand it, and it gives you a good jumping-off point then to figure out, what it is that you're researching, and where you may want to look deeper. So I think that's an excellent site.
You got anything to poke at? Well, in our last 5 minutes or so.
Poke at?
Yeah, well, something to look up that. To give a good example.
I don't know. Why don't you?
What's something that happened in class this week, or with one of the local beagles, as they were?
One of the local beagles. Think. Well, we've got some cats with some conjunctivitis.
Okay.
Going on right now with Mary and Ricky Bobby.
Do we know why?
It's usually associated with the feline upper respiratory type organisms, things like chlamydia and feline herpes virus. And
every time I hear chlamydia, I think koala bears.
Oh, well, in cats, it's not a sexually transmitted.
Oh, okay.
Yeah.
Interesting. Well, obviously, it's a sexually transmitted disease. I didn't know it could not be sexually transmitted and transmitted by other vectors in other species. I knew it was zoonotic. Zoonotic?
I say zoonotic.
All right.
But I guess it depends on...
Prion?
Well, I guess it depends on whether you're going to emphasize that third O. Is it zoonotic or is it zoonotic?
True.
Right? It's different when you're saying zoology because we're saying ology, so you want to say zoology and not zoology. Otherwise, that would be 3 O's. It would be Z-O-O-O, zoology.
I had never thought about it.
Yeah, I'm nitpicky about those sorts of things.
But
I was discussing with the first years this morning. Somebody said something about the library, and they were jokingly pronouncing it that way. And I said, people think it's funny to say library or incorrect, but yet no one ever pronounces our current month correctly.
February?
No, there's an R in there. It's February.
Nobody says February.
Well, why is library? That's BR. So is February. That's BR.
Well, what's
People look at you funny if you say library, but why is it okay to say February?
Well, what's the etymology of February?
I don't know, honestly.
And that'll be our closing topic.
I'm not sure what the etymology of March is either. I know that January was from the Greek god Janus, who had two faces, one looking forward and one looking to the rear, because January being the first month, you look back at the last year, and then
July is
after Julius Caesar, and August after Augustus Caesar.
Yeah.
October was once originally the 8th month,
Mm-hmm.
but things got changed. Same thing with November, December, 9 and 10. March might be...
Februarius was named after the Latin term februm, which means purification.
Huh.
So that makes sense for like the coming of spring and leaving winter behind.
Yeah, and March, is that named after... Is that Mars, after the god of war?
I would
god of war?
assume Mars, yeah.
Okay. Well, you got your Dictionarius Universalis, or whatever Encyclopedia Universalis in your hand there?
Encyclopedia Universalis, which is what I've been calling phones for years.
Yeah.
It makes sense. It's all of the information you could ever want at your fingertips.
And
You
more. Some information you don't want. You know,
just need to know how to look for it.
there are studies that show that staring at those screens are making us all depressed and
Yes.
anxious, and
It's because of how our eyes work and our relation. It's human ethology at that point.
it is.
Thank you.
Isn't that called psychology?
That's
human
how
ethology?
Human brains
Oh,
work.
okay.
Because there's a difference between behavior and how we think.
That's fair.
Because you can have a cat that thinks perfectly fine, but it's going to look a little weird. Thank you very much for joining me, Dr. Sy. This is a little more
thank you.
haphazard than our last round.
Really?
Yeah,
You think so?
yeah.
Oh,
I think it'll be fine.
okay. Yeah, so if you're listening, leave us some comments. Tell us
Yeah.
what you want to hear about. Make this useful.
He's right. We do want to hear from our audience, what little there is, about what you guys would like to hear. So please, I've attached a link, hopefully in the description of this podcast, for you to fill out a poll for what you'd like to hear on the podcast. Thank you again for listening, and hope to see you next week on the next episode.